Good morning, doctors. Welcome again. This is Neet PG Test Series 3 for 2021 examination. First question. Superior rectal vein opens into 30 seconds in your hands. Pause this video. Take copy and pen and write which is the best answer. If you score 70%, that means your rank is below 3000. If you score 50%, that means your rank is you are going to clear exam, and below 50 means doubt. So inferior mesenteric vein, superior rectal vein drains into inferior mesenteric vein. So here is the explanation. Inferior rectal vein drain in internal pudendal vein, whereas superior rectal vein in inferior mesenteric veins. Now, compared to minimal baseline level of cortisol, in evening rise in both ACTH and cortisol levels are likely to be seen in. So this is seen in Cushing's disease, mainly seen in Cushing's disease. Okay. Now, ferrosilitase is inhibited by. So all options in front of you, try to answer which one is the best. Take 30 seconds and write answer. So which is the best here? Ferrosilitase is by arsenic or by lead or by mercury or chromium. So what is your single best answer here? So answer is lead. Okay. Now, platelet is usually stored at 22 degrees Celsius to 24 degrees Celsius, whereas 2 to 6 degrees Celsius we stored RBCs, packed cells, and whole blood, whereas cryoprecipitate and fresh frozen plasma at minus 18 FFP and cryoprecipitate. This table explains. Now, which statement best describe mechanism of action of azoles? So try to answer in comment box what is the mechanism of action of azoles. It's synthesis of ergosterol or what? So try to answer which one is the best answer here. You have 30 seconds in your hands, so that is, think which one is the best one here. So the answer here is synthesis of ergosterol. Okay. Now, which of the following causes atypical pneumonia? So atypical pneumonia is caused by coronavirus. Okay. Atypical pneumonia by most common is mycoplasma. Viruses influenza, RSV, adeno, rhino, corona, legionella, chlamydia, coxiella burnetii, and zerovasi. Okay. Now, in a civil case of medical negligence against a doctor, the onus of proof lies upon. So the best answer here is patient. Now, what is the diagnosis in this radiograph? So this is a case of spondylolisthesis. Okay. Spondylolisthesis involves forward displacement of one vertebra over another, most commonly involve L4, L5, L5, S1. Okay. Most characteristic feature of fungal corneal ulcer is, so characteristic feature for fungal corneal ulcer is stellate lesion. Okay. Elective tracheostomy is done at what level? It is mainly done at the level of thyroid isthmus. At the level of thyroid isthmus. Okay. Now, after reconstitution, measles vaccine should be used within 1 hour. This is mainly used within 1 hour. Okay. Which of the following is not seen in patent ductus arteriosus? In patent ductus arteriosus, what happened? This is sorry. Okay, this is pulmonary trunk. This one is aorta, and this is opening. This is PDA, patent opening. So when blood enters from aorta to pulmonary trunk, then pulmonary vein drain into left atrium. So left atrium hypertrophy enlargement and left ventricular hypertrophy enlargement occurs, and continuous machinery murmurs we see, but attenuated S1 we are not going to see. Okay. Autistic spectrum is a disorder of Autistic spectrum is a disorder of defective communication. This is mainly a disorder of defective communication. Okay. Sorry. Mode of administration of radioactive iodine is intravenous, subcutaneous, oral. So all as answer. Now, anesthetic agent which can lead to bone marrow depression is caused by nitrous oxide, and it also causes vitamin B12 deficiency. Okay, identify the condition. So this condition represents a DLE, discoid lupus erythematosus. This is a DLE. Okay. In modern day obstetrics, most common cause of ruptured uterus is, nowadays number of cesarean cases are increased. That's why previous LSCS scar rupture is more common. Okay. Which of the following is not seen in ASD? ASD, which of the following we are not going to see? Listen, this is right atrium, this is left atrium, right ventricle, left ventricle. What happens? Blood goes from here. So, right atrial enlargement we see, yes, and pulmonary hypertension because pressure in right ventricle increase, yes, and widely split S2 we see, but left atrial enlargement we are not going to see. So answer is A. So left atrial enlargement in ASD happens when there is Ishii-Menger's syndrome, reversal of shunt. Okay. Not true about somnambulism among the following is, in somnambulism we see sleepwalking occurs during NREM, non-rapid eye movement sleep, disorder of sleep arousal, yes, but only low level of motor skill function is present. This is absolutely wrong. Now, remote afterloaders is employed with reference to brachytherapy. This is mainly referred to brachytherapy. MAC of an anesthetic agent is measure of its minimum alveolar concentration, measure of its potency, mainly measure of its potency. What is this image? Even in my WhatsApp group I asked similar MCQ. This is condyloma acuminata. So no need to see this MCQ, you can directly answer. This is condyloma acuminata. MCQ is female presented with soft, sessile and watery lesion on vulva which were spreading to other parts. What is diagnosis? Condyloma acuminata. Okay. True about cephala hematoma is, venous delivery is a risk factor. C option is a right. Now, 5-year-old child with acute liver failure due to Wilson's disease. Which of the following criteria not included in the King's College criteria? Age less than 10 years, INR more than 6.5, bilirubin more than 17, jaundice less than 7 days, development of encephalopathy. So this one is the answer. Okay. Yeah, jaundice lies in 7 days before development of encephalopathy is the answer. Here the explanation of King College criteria. In this we see age less than 11 years, so less than 10 is normal. Included in this criteria not normal, and INR more than 6.5. Yes, INR is more than 6.5, and bilirubin is more than 7. Yes, but the duration of jaundice more than 7 days before onset of encephalopathy. Okay. As per NECP ATP3, which is not included in metabolic syndrome, that is not included is high LDL level. Metabolic syndrome include abdominal obesity, waist circumference more than 102, and in female it's more than 88 centimeter, triglyceride more than 150, and HDL less than 40, and in female it's less than 50, BP is more than 130/85, fasting plasma glucose is more than 100. So guys, I already finished with test series 3. If you have any queries, any question, you can ask me, and if somebody is new on my channel, please subscribe it, and if you like my videos, put like on it. Thank you, good day, goodbye. That's all for today.